In terms of snoring, I don't, if a patient came to me, say the wife comes and the husband, and she's sleeping in the other part of the house and he's driving her crazy, yeah. And he's not even aware of it. And you mention it to the other bed partner and they laugh about it. Oh, I don't hear it, that kind of stuff. Again, we don't treat snoring, but snoring or heavy snoring oftentimes is associated with something called sleep apnea. And sleep apnea is basically, in addition to the snoring, people actually stop breathing. And oftentimes that's what the bed partner will bring up to me. My husband stops breathing, they're worried about it. Because you stop breathing for 10, 20, 30 seconds, it's kind of scary, over and over again. This is what happens. So we can treat snoring, but we treat the snoring in relation to if they have sleep apnea. So I'll send the patient to a sleep lab or order a home sleep study and see if they have sleep apnea first. And then if they have sleep apnea, we treat the sleep apnea and it treats the snoring at the same time. If they don't have sleep apnea, we still have the option of treating the snoring, but at least I know whether they have sleep apnea or not sleep apnea, because there's all these devices that you see for next to nothing on TV. I don't know how they get away with it, and then they mentioned treating snoring. Yeah, so you can actually put one of these devices in, and in some patients, that will mitigate or reduce the snoring to acceptable level, and maybe, I don't know if it takes it all away, but more acceptable. But they still could have sleep apnea. And it's sort of a hidden apnea, and the patient can develop, well, they could die, or they can develop high blood pressure, have heart problems, psychological problems, all kinds of things happening. Because when you're not breathing, there's no oxygen going through your body, especially to your brain. It's not a good scene to starve your brain for oxygen. So we can treat snoring, but I make sure to see if there's apnea involved with it.